Fourth semester, first subject is Conventional Radiographic Technique Part 2. In Conventional Radiographic Technique Part 2, they will teach you about the advanced fluoroscopic machine, and they will teach you about the C-arm that is used in surgery department, or advanced modalities that is used in cath lab. Second subject is special radiographic procedure. In special radiographic procedure, they will teach you about the contrast media, applications of the contrast media, different contrast media that is used in radiology department, and most important thing, they will teach you about the radiographic procedures. So there are different radiographic procedure. For example, there is barium studies, that is barium solo, barium meal follow through, and barium enema, that is done for the to view the different pathologies in different region. And there are IVP, that is intravenous pyelography for the excretory system, retrograde ureterography, and cholangiography. So they are the different special radiographic procedures, and it is very important for technologists to learn these radiographic procedures thoroughly. So the third subject is basic ultrasonography and the mammography. In this subject, they will teach you about the physics behind the ultrasonography, no clinical part, only the physics behind the ultrasonography. They will teach you about the piezoelectric effect, reverse piezoelectric effect. They will teach you about the different modes that is used in radiology, that is used in ultrasonography, that is A mode, B mode, M mode, what are the physics behind. So they will teach you in ultrasonography, basic ultrasonography. In mammography, they will teach you about the mammography X-ray machine, because it is little bit different from the conventional X-ray unit. So they will teach you about those things in mammography. They will teach you about the different views that are used in screening of breast cancer, that is craniocaudal and mediolateral views. So they will teach you about these things in mammography. Basic of CT scan, they will teach you in this subject. They will teach you about the generation of the CT scan, and they will tell you about the part of the CT scan, gantry, how the gantry is working, what are the stationary part, what are the rotatory part in the gantry. So they will teach you about these things in basic of CT scan. There will be no clinical part in this subject. And the last one is orientation in paraclinical science. So orientation in paraclinical science, they will teach you about the diseases, they will teach you about the inflammation, what is the inflammation, types of inflammation, what are the fractures. They will teach you about the fractures. They will teach you about some disease in cardiovascular system, for example cardiomegaly. How will you identify that patient is having cardiomegaly by seeing the X-ray. So they will teach you about the clinical part in this subject, that is orientation in clinical science. Fifth semester, there are only 4 subjects. First one is magnetic resonance imaging. It is one of the toughest subject to understand, because there is lot of physics behind it, and you have to understand NMR before understanding the MRI. I know there is no difference between NMR and MRI, but there are some concepts in NMR that is very important to understand magnetic resonance imaging, and they will teach you how to work on MRI system also. Second subject is hospital practice and care of patient. They will teach you about how to take care of patient, and how to move patient from the emergency department or any other department to the radiology department, and how to take care if the patient is coming to the radiology department with any equipment attached to it, for example oxygen cylinder. So how will you take care of those things? So they will teach you in this subject. Third one is orientation in clinical science. This is the second part of orientation in paraclinical science. They will teach you about the cardiovascular diseases, excretory system diseases. They will teach you about the congenital diseases, congenital deformities, for example hydrocephalus and horseshoe shaped kidney. So these things come under the orientation in clinical sciences. Last one is basic preventive medicine and community healthcare. So it is clear from the name, they will teach you about the community healthcare and some diseases, for example polio, and there are some programs that they will teach you. For example, they will teach you about the cancer program and tuberculosis program, how to control the tuberculosis program. So they are the national programs which are running to prevent these diseases from spreading. So they will teach you about these things in basic preventive medicine. And semester, there are only 4 subjects. First one is advanced CT, MRI and USG. In advanced CT, MRI and USG, they will teach you about the advanced application of these modalities. First one is advanced CT. In advanced CT, they will teach you about the CT guided biopsy, CT angiography, CT coronary angiography, CT peripheral angiography, and in CT and in advanced MRI they will teach you about the pulse sequences, they will teach you about the STIR, flare and spin echo sequences, diffusion weighted image. So and in USG, last one, and in USG they will teach you about the different modes, A mode, M mode, B mode, and they will teach you about the application of transvaginal sonography, transrectal sonography. Second subject is nuclear medicine technology and the PET scan. They will teach you about the gamma camera and the physics behind the PET scan, how PET scan work, how SPECT work, what are the radiopharmaceuticals, what are the radiation hazard due to those radiopharmaceuticals, manufacturing of the radiopharmaceuticals. So they will teach in these things in this subject. The third one is interventional procedure and the emergency drug. So they will teach you about the interventional procedures, they will teach you about the catheters, the different techniques that is used in cath lab. So, and the second part is emergency drugs. So after administration of contrast media, some of the patient may have the anaphylactic reaction. So they will teach you about the emergency drugs, how to control those anaphylactic reaction in patient. The last one is research methodology and the biostatistics. In biostatistics they will teach you about the mean, mode and median, those things, and they will teach you about the ungrouped data, group data, how the research is done, how will you perform a research, how will you make a research paper, how to write a research paper. So those things come under this subject, that is research methodology and the biostatistics. Still one part is missing, that is practical. For practical you will have your posting in different radiology department, and technology there will teach you how to handle those machines, how to perform certain procedures on those machines, how to perform certain radiographic procedures, how to perform, how to take the patient history. So that is there in department, and it is very interesting to work in radiology department.